Oliver Sacks, Hallucinations. Dive into a fascinating exploration of the human mind in the book Hallucinations by Oliver Sacks. In this summary, you will discover how hallucinations occur, spanning a range of scenarios from Charles Bonnet syndrome in people with visual impairments to the impact of sensory deprivation on our perception. Understand the roles of neurological conditions such as Parkinson's and Alzheimer's in hallucinations, and learn about the effects of psychedelic drugs and migraines on our interpretations of reality. Additionally, gain insights on how sleep disorders and emotional states, such as grief and post-traumatic stress disorder, can cause hallucinatory experiences.
Hallucinations and the brain. Perception versus reality, the science behind visual hallucinations. Hallucinations are a common phenomenon experienced by many, especially those who are blind or visually impaired. This is known as the Charles Bonnet syndrome, CBS, and was first described in 1760 by a gene van naturalist named Charles Bonnet. The CBS hallucinations are so vivid and realistic that patients often mistake them for reality. This happens because the hallucinations come from the same areas of the brain as visual perception. In fact, a study shows that almost 90% of elderly people with visual problems experience some form of hallucinations. Additionally, sensory deprivation can also lead to visual hallucinations. When a person is exposed to the same monotonous scene, such as darkness, for an extended period, their brain creates visions, ranging from simple patterns to complex scenes. This phenomenon is known as the prisoner's cinema. Therefore, what one perceives may not always be reality. The brain processes sensory information and creates perceptions that may or may not correspond to external reality. The science behind visual hallucinations helps us understand that the brain is a complex organ that requires further exploration. Smell and sound hallucinations. Smell and sound hallucinations are more common than most people think. Losing the sense of smell completely, also called anosmia, affects about 5% of people. Losing some parts of it leads to sensory distortions, called dysosmia. Perfume, coffee and cars might smell unbearably strong to those with dysosmia. Also, dysosmia affects people's sense of taste, making them taste metallic and rotten. Auditory hallucinations are also widely spread, and most people who hear voices are not suffering from severe mental disorders. Hearing your own name is the most common auditory hallucination. Breaching the barrier that prevents us from hearing our own internal voices is a possible explanation for hallucinating unremarkable voices. Hallucinations in degenerative diseases. Parkinson's disease is a degenerative disease that affects many people and causes shaky, rigid, and slow movements. Researchers later discovered that over a third of those affected also experienced hallucinations. Degenerative diseases, including Alzheimer's disease, often result in complex and multisensory hallucinations. L-Dopa is a drug that is used to treat Parkinson's disease by heightening dopamine responsiveness, which can lead to hallucinations similar to LSD. People with Parkinson's who experience hallucinations like these don't always consider them bad, with some reporting their hallucinations are fascinating and enjoyable. Other forms of dementia like Alzheimer's disease also cause hallucinations, often involving disorientation, confusion, and delusions. Patients may imagine that people or things around them have changed in some way. In conclusion, as we age and suffer from degenerative diseases, the likelihood of experiencing hallucinations increases. Phantom limbs and other body hallucinations. The phenomenon of phantom limbs, where an amputee feels as if the amputated limb is still attached to their body, is a common experience. Neurologist Silas Ware Mitchell coined the term in 1870, and it is a unique form of hallucination that appears almost immediately after amputation. People with phantom limbs feel that they are a regular part of their body and can move them voluntarily. This kind of hallucination is distinct from other hallucinations associated with sensory impairment. In some cases, amputees can still use their phantom limb, as seen in the case of pianist Paul Wittgenstein, who continued to teach piano with his left stump. The article also explores other body hallucinations, such as doubles or shadows that are even stranger than phantom limbs. One man who had to undergo parietal lobe surgery believed that someone had left a dead, cold leg in his bed, when in fact it was his own, still attached. The Science of Psychedelics. Psychedelic drugs have different effects on the brain, including vivid hallucinations and stimulation of complex brain functions. This summary highlights some of the psychoactive substances found in plants and labs, their effects, and how they contribute to better understanding the brain's neurological complexities. Psychedelic drugs have been used by many people to achieve specific experiences, including intense feelings of pleasure and euphoria. Mescaline, found in some cactuses, causes hallucinations of complicated geometrical patterns, while psilocybin, present in many mushrooms, can lead to delightful colorful visual experiences. In 1938, Schultz and Hoffman documented the catalog of nearly 100 plants containing psychoactive substances in Plants of the Gods. As research in the field continued, scientists discovered mightier chemicals that can stimulate complex functions in the brain. Delirium, or the experiencing of hallucinations from alcohol toxicity, withdrawal or other common causes such as fever, can lead to the Alice in Wonderland syndrome, a condition where people imagine their body is growing or shrinking, resulting in rhythmic and pulsing visual hallucinations. Dr. Sachs acquainted himself with psychedelic drugs, particularly LSD, to gain better insight into the neurological complexities of the brain. In summary, this insightful excerpt highlights some significant aspects of the science of psychedelics, their positive and negative effects on the brain, and how they contribute to our understanding of the human nervous system. Migraines and epilepsy hallucinations. Migraine auras are hallucinations caused by electrical disturbances in the brain. They result in visual disturbances like scintillating scotoma. Epileptic fits also give rise to complex hallucinations in both visual and auditory areas. The two disorders are often confused due to similar symptoms and underlying neurological issues. Hallucinations during sleep. Learn about the different types of hallucinations one can experience during sleep and why they occur. Have you ever woken up in the middle of the night, feeling paralyzed with an eerie presence looming in your room? Many people have experienced sleep paralysis accompanied by vivid hallucinations. These hallucinations are often a result of sleep disorders such as narcolepsy and are known to be vivid, tactile and audible. Narcolepsy is a result of the body failing to maintain a stable sleep-wake cycle, leading to sudden sleep attacks. These attacks can be accompanied by hypnagogic hallucinations, images that emerge involuntarily just before sleep. These images range from simple sounds to complex, ever-changing visuals. The brain activates random neural networks, leading to these colorful and lifelike images. Christina, a correspondent of Sachs, struggled with sleep paralysis for years, leading to terrifying hallucinations. She would feel an oppressive weight on her chest, followed by an eerie man in a black suit, screaming at her. These hallucinations can be very real, causing psychological distress, and are often the reason behind belief in supernatural beings like incubi and succubi. These hallucinations are not uncommon. In fact, the majority of people have experienced hypnagogic images at least once in their lives. Researchers are still delving into the science behind these hallucinations and their relationship with sleep disorders. Hallucinations from emotional pain. Hallucinations are typically caused by physical or mental impairment, illness, or sensory deprivation, and are usually considered meaningless. However, when they stem from extreme emotional states such as grief or trauma, they can have deeper significance. Grief can cause hallucinations in the form of imagined returns to past experiences. PTSD sufferers often experience vivid flashbacks of their traumatic experience. A study found that nearly half of bereaved spouses hallucinated their dead partners, and the likelihood of this occurring increased with the length of the marriage. In these cases, the hallucinations seem to be tied to the emotional needs of the bereaver. Hallucinations from trauma can lead to dangerous delusional states, with sufferers mistaking people for enemy soldiers. By understanding more about how hallucinations from emotional pain work, we can help those who suffer from them, offering support and a more accurate diagnosis.
Through the book Summary of Hallucinations by Oliver Sacks, we have journeyed through the various ways the human brain can produce hallucinations, be it due to sensory impairments, neurological conditions, or intense emotional states. The impact of drugs, sleep disorders, migraines, and epilepsy show how versatile our brain's ability to create these visions can be. Moreover, emotional factors like grief and trauma have been shown to trigger hallucinations, demonstrating the intricate relationship between our emotional needs and the workings of our minds. Overall, it is evident that hallucinations have wide-ranging implications that contribute significantly to our understanding of the complex human mind.